Good evening. Welcome to all. Today, the 47th weekly academic program, online academic program of Pudukkottai Budan, ISA Pudukkottai branch. From team Pudukkottai Budan, I welcome you all for this today's webinar. Today, we have some interesting topic on stress. We have three speakers. Professor Dr. Ashok Deshpande from Bharati Medical College, Shangli, Maharashtra, is going to talk on stress-free anesthesia practice. The next one is Professor Dr. Balasubramaniam, HOD in Emergency Medicine, Government Theni Medical College, Tamil Nadu, is going to talk on perioperative stress. And Dr. Vikneshwaran, resident in cardiac anesthesia, Madurai Meenakshi Mission Hospital and Research Center, Madurai, Tamil Nadu, is going to talk on stress cardiomyopathy and its perioperative implications. We have here our past state secretary, Professor Dr. Bhaskar from Institute of Social Obstetrics, Chennai, as chairperson. Now I welcome our secretary, Dr. Periyasamy, to deliver the welcome address and introduce the speakers. Over to Dr. Periyasamy, please.
Thank you, sir. Respected academic chairman, Dr. A.L. Minachandram, sir, President Dr. Suresh Kumar, sir, President Dr. David, and members of ISA Pudukkottai and delegates those who are attending this 47th ISA online webinar program. On behalf of ISA Pudukkottai, I welcome you all for this Pudukkottai Budan 47th event. I think this is a historical event which we are conducting this event continuously from March 23rd of 2022 without any break. Now we entered the 47th event and we are going to talk about three important topics. These are the topics which we already discussed in various meeting, and we are going to have three important topics today. One is stress-free anesthesia practice, and another one is perioperative stress, and third one is stress cardiomyopathy and perioperative implications. These are the three topics. I think this is more new to this anesthesia because anesthetists are always under stress, preoperatively, intraoperatively, and postoperatively, because we used to anticipate something and we are ready to face this also. So we are always under stress. To reduce this stress, we have to have some important topics. For that, I invite Dr. N. Bhaskar, Professor of Anesthesiology, ISO at Government Medical College, Chennai, as a chairperson on behalf of ISA Pudukkottai, and three eminent speakers to talk about different topics. I invite Dr. Ashok Deshpande. I welcome you, sir, on behalf of ISA Pudukkottai. Head of the Department of Clinical and Lab, Bharati Medical College, Shangli, Anesthesia Practice. On behalf of ISA Pudukkottai, I once again welcome you, sir. Next speaker, Dr. M. Balasubramaniam, Professor and HOD, Department of Emergency Medicine, Government Theni Medical College, Theni. Sir is going to talk on perioperative stress. On behalf of ISA Pudukkottai, I welcome you, sir. Third topic is stress cardiomyopathy and preoperative implications. This is going to talk by Dr. Vikneshwaran, resident, cardiac anesthesia, Meenakshi Mission Hospital, Madurai. On behalf of ISA Pudukkottai, once again, I welcome you all for this 47th ISA online webinar program. This 47th event is happened and possible because of our academic chairman Dr. A.L. Minasundram sir because of his hard work and continuous effort. So once again, on behalf of ISA Pudukkottai, I would like to thank our academic chairman and speakers who are attending this event, and chairperson. I welcome you, sir. And regarding this event, if you are having any doubt, you can call me or send mail to this isa.pudukkottai@yahoo.com for your doubts and any clarifications. Today, we are going to talk about some stress industry events. A small poem about that stress. Stress-free life. For stress-free life, influence the power for good and ensure the health as well. Organize the life around peace. Open your heart with fear-free mind for stress-free life. Calmness of mind will come in contented life. Educating others will enlighten their mind. Always predict everything before it happens. Plan everything with positive attitude. Smiling diffuse high pressure and stress. Smooth, slow, and steady sailing will win the race. For stress-free life, loving everyone will be peace. Every day, pleasantly bring more success and relieve our stress. With this, I once again welcome you all for this 47 program, and thank you for the opportunity. Over to President Dr. Suresh Kumar sir. Thank you, sir.
Thank you, Dr. Periswamy. Respected Secretary Periswamy, Treasurer Dr. David, our branch academic chairman, Professor Dr. A.L. Meenachuthnam sir, chairperson of this webinar, Professor Dr. Bhaskar sir, speakers, Professor Dr. Ashok Deshpande, Professor Dr. Balasubramaniam, and Dr. Vigneshwaran of today's webinar. Respected Dr. Kumar sir, past state president of ISA Tamil Nadu, senior members, practicing anesthesiologists, budding anesthesiologists, postgraduates who have assembled here. As president of ISA Pudukkottai branch, I welcome you all again for this webinar. Our academic chairman has chosen a good topic today, stress. Stress is an universal phenomenon. Everybody will be facing at every moment of our life. And we should not forget the patient also we are subjecting for anesthesia will be having stress. So this topic will widely cover is stress of anesthesiologist, stress of patient and the environment. So this is a good topic chosen by our academic chairman. Pudukkottai Budan, for the past 46 episodes, we have covered so many topics and very good speakers have spoken here. It's a good platform for the practicing anesthesiologists and postgraduates to update their knowledge. And we are cruising for the 52 episodes we have planned so far. At this juncture, I thank our academic chairman for making this moment as a wonderful thing. Regarding stress, every anesthesiologist will be having a very good or very huge amount of stress in their life. So I eagerly wait for the Dr. Ashok Deshpande's talk on how to lead a stress-free life during our anesthesia practice. And regarding perioperative stress, this is a very good topic. Will be covered HOD of Theni Medical College, Dr. Balasubramaniam sir, and stress cardiomyopathy in acute fulminant stress by our resident Dr. Vigneshwaran. So the three topics we are waiting for the today's topic. We are waiting for it for the enlightenment. And regarding our chairperson, Professor Dr. Bhaskar sir, it's a good choice of today's topic. He would have overcome so many stress in this government and other private anesthesia practice. So the chairperson will be the nice choice by our academic chairman. I request everybody to participate fully and enjoy in the chat discussions at the end of the topic. Now I hand over the proceedings to our academic chairman, Dr. A.L.M. sir. Over to Dr. A.L.M.
Thank you, Dr. Suresh Kumar, President ISA, respected faculties and office bearers of ISA Pudukkottai. Warm welcome to you all. Everybody appreciates today's topic because everyone is under tremendous stress. So Team Pudukkottai is under severe stress for the 47 weeks, and we are all waiting how to cover the remaining 5 weeks webinar to reach that 52 landmark. So we want to have a valedictory function on that 52nd episode. That is 1 year. It is really a tough job, and I could not even imagine whether it is possible for anyone to do this. And Pudukkottai, even though at the infantile stage, it has shown the courage to do that. And whether anybody is developing stress or not, I am developing severe stress. So if there is a valedictory function that is March 15th, we are all expecting when March 15th will come, because 52 episodes with 4 speakers, it is really a tough job, and we have achieved it to some extent. We have to cover the remaining 4, and today we are having that youngest speaker, Dr. Vigneshwaran. We thank Dr. Kumar, our former ISA state president, and who is heading Meenakshi Medical Mission in Madurai, because he is the one who has created awareness, at least for me. He says stress produces cardiomyopathy, which I have never thought, because when we were postgraduate and assistants, whenever a patient undergoing a delivery develops some complication, we label it as amniotic fluid embolism or peripartum cardiomyopathy. These are all the 2 words, but he started saying now the incidence is increasing even in normal people undergoing delivery. So we want to create awareness that stress also produces cardiomyopathy, and in the perioperative period it is very common. So Dr. Vigneshwaran has done his MD anesthesiology. He is a post MD resident. He is a cardiac anesthesia resident. So he has done his MD in Manakula Vinayagar Medical College, and he is doing his DM cardiac anesthesiology, that is a diploma in under the guidance of Dr. Kumar. So we welcome him. And the next speaker will be Dr. Balasubramanian, who is the head of the department emergency medicine. He is basically an anesthetist. He is heading the department of emergency medicine in Theni Medical College, and he is one of the pioneers in applying for NABH accreditation for Theni Medical College. He is working side by side for that also. So without any stress, he is balancing both. So we want to have him as a faculty to deliver a lecture on perioperative stress. He is now stress free because he is doing only emergency medicine, and he is not concentrating on perioperative care. So he is additionally shouldering the responsibility of training the staff nurses as well as the paramedical people in emergency medicine. So he is the right choice. He is the secretary of ISA Theni branch. And Dr. Ashok Deshpande, we need not elaborate on him because he is well known for his expertise in anesthesia, as well as he is very casual. So he is the right person to talk about stress-free anesthesia practice. Even the sky falls on earth, he will be smiling. So he is the right choice. He is the former secretary, president of ISA Maharashtra. Presently, he is a governing council member, ISA National. He is very good at skill lab, trained at undergone training in US. So what not? So he is the right person. So when these people elaborate on stress, not only our president, everybody wants to listen to Dr. Ashok Deshpande, how to have a stress-free anesthesia practice. So the Pudukkottai team has given him extra 15 minutes instead of this 30 minutes, because that is going to be a stress-free lecture. So that 45 minutes will not be stressful. It will be stress-free. So we have given him more time and he is really giving the practical tips how to avoid stress in the anesthesia practice, real practice. So if I am talking, I will be talking some out of box thinking. With the some out of box thinking, I will talk. He is talking to the core. As an anesthesiologist, when you are going for a case, how to avoid stress. Really, it is a thought-provoking lecture. So we have to listen to that. And now, then we were searching for the chairperson. Only at the end, we will be searching for the chairperson. So luckily, Dr. Bhaskar has come because Dr. Bhaskar has seen so much of a stress as a ISA state secretary and ISA branch secretary also. But
Truth,
because
sir.
of Dr. Kumar, he could succeed to some extent because Kumar is very casual. Whatever, he is a junior Deshpande and Ashok is a senior Kumar. So I can compare that way. But Dr. Bhaskar has undergone tremendous pressure and he has come out of that. So I thought so he is the ideal person. So I asked immediately, he said yes, because he thought this is not a stress for him and he is heading the unit in social obstetrics. And now he is attached as a professor at the prestigious Madras Medical College, that is RGGH Chennai. So he is presently state secretary. He still clings on to that post. He has to carry it for one more year. Then he will be the more stress-free person on earth. Once he completes his 3-year term, he will be the stress-free person. And everybody, Dr. Kumar has crossed that. So we like Dr. Bhaskar to come up to the higher position to shoulder more stress. Now I hand over the stress session to Dr. Bhaskar and I am getting relieved of my stress. Thank you.
Sir,
Sir.
1 minute, sir.
Yes, sir.
Can I, sir?
Yes.
Yeah. Stress also brings the humans by setting the goals and fulfilling the goals. You are the best example, sir. Dr. Ailam, sir.
We
I
will
just
set the
want to
goal into
register.
50 seconds.
I just want to register in this platform with so many amount of stress. You have always won the goal you have set for. Thank you. Thank you, sir.
Thank you then. Thanks for your compliments. Over to Dr. Bhaskar.
Sir, thank you very much, sir. Thank you very much for a very good introduction, sir. First of all, I thank ISA Pudukkottai for giving me the opportunity to chat this session. And I welcome all the senior members, ISA members, and our delegates and postgraduate attending this session. What sir told is very correct. Stress will be there at any part of your life. You have to come across the stress. But at this junction, I want to place our ALM sir as the model on how to handle the stress. See, it is he being the dean as well as the DME, and he is doing other work like regarding Tamil Kannadasan programs, all these things. I really wonder how he brings time, able to carve time out of his. Once I even asked him, he told very clearly, you have to make yourself time for this thing, for whichever passionate, which you are passionate. So he is a really standing example on how to handle the stress and make the stress as a fuel to run your life. Nobody will be out of stress. Every living thing on this earth will have stress. Only thing we have to know how to handle the stress and make it as a positive way to go further. So I don't want to waste much time because like all told, I'm also waiting for Deshpande sir's lecture. So straight away, I'll hand over this, start this session with our Balasubramani sir. His topic as perioperative stress. Sir?
Yes, sir.
Sir?
Yes, sir. Yes, sir.
You can start presenting, sir.
Yes, sir.
Yeah, right.
Setting the content. So, am I visible, sir?
So very much, sir. Clear, sir.
Yes, sir. First of all, I thank our DME, sir, as well as the academic chairman for tireless and continuous effort to run this academic weekly program. He has passed the 46 programs and successfully running the 47th program. And I thank the ISA Pudukkottai office bearers also for supporting this. And I welcome the chairperson, Dr. Bhaskar sir also. So we enter into the topic proper. So once we step up into the operation theater, the anesthetist as well as the patient both will be in the stress. So here today, we mainly bother about the stress of the patients and how to deal with it. So once the patient is told about the surgery, in an elective surgery, the patient immediately get into the stress period. The hypothalamus, pituitary, adrenal axis immediately started. So the stress in pre-op is also continuing into the intraoperative and postoperative period also. So we have to careful about the intraoperative management and continue the management for the successful outcome in the postoperative period also. So the time course of the metabolic response to the patient's stress under the surgery will start within the seconds or minutes of the surgical incision. Not only the surgical incision, but also the starting of the anesthesia. So immediately the sympathetic nervous system will be activated within minutes through the adrenergic receptors as well as through the hormones secreted from the adrenal medulla. Again, within hour, the hypothalamic pituitary axis will start functioning and responding to the stress, the surgical stress. It also responds to the surgery, trauma, and sepsis in the same way. The surgery is an incision, is a controlled stress that we have to deal with it. The hypothalamic pituitary axis also functioning even whatever the good anesthesia it may be. Then the inflammation and the immune system, likewise with the cytokines and the mediators, start within the days and continuing and repairing work will be done later on. The response components may be in the stage of physiological consequences or in the metabolic manifestations or in the form of clinical manifestations and with the laboratory changes. The physiological components of the stress response may be increased cardiac output, increased ventilation, increased membrane transport, and weight loss with the wound healing. The metabolic component may be the hypermetabolism. The increased metabolism will pose the patient into the trouble. The accelerated gluconeogenesis and enhanced protein breakdown, both from the muscle as well as from the liver, will take place during the stress period. The increased fat oxidation and the release of free fatty acids into the systemic circulation will pose the problematic situation for the stress patient. The clinical components may be presenting with the fever, tachycardia, tachypnea, and the presence of wound inflammation and anorexia. The laboratory investigation will pose on hyperglycemia due to the all counter-regulatory hormones and decreased insulin secretions. The patient will go for a raised blood sugar and the patients will have the leukocytosis or leukopenia. The patients will have increased acute phase reactants, acute phase proteins, the CRP, everything are elevated. Finally, the patients will have the hepatic and renal dysfunction. So what are the mediators will pose the stress come into action? The stress is mediated through the neuroendocrine, that is hormonal mechanism, as well as the inflammatory and immunological mechanisms through the cytokines and the mediators. The neuroendocrine system will be activated by the afferent nerve stimulation once the surgeon start putting the knife on the patient, and directly it will reflect on the brain through the hypothalamus. The hypothalamus activated and will give some hormones, and it will in turn activate the pituitary, and in turn it will activate the adrenal axis. So the sympathetic nervous system will be activated immediately after the knife, and the adrenal medulla will secrete many hormones, will force the system into the stress. The endocrine system, the following glands plays a major role in mediating the response of the stress due to the surgery. The pituitary gland will secrete increase in the growth hormone level and ACTH level and the arginine vasopressin level into the systemic circulation. It will in turn act on the adrenal gland and increase the cortisol level and increase the aldosterone secretions. The pancreatic system, it will secrete the glucagon, which is a counter-regulatory hormone, will also decrease the insulin secretions, will force the system into the hyperglycemic state. And the other hormones, the renin, angiotensin, will be secreted more and will also have a systemic effect like sodium and water retention. And the sex hormones also modified with the thyroid hormones. This is the simplified pictorial demonstration. After any injury like surgery, trauma, or sepsis, the immediate afferent nociceptive pathways will send the signals to the brain, mainly to the hypothalamus. The hypothalamus will secrete the hormones, will in turn stimulate the pituitary and secrete the ACTH and growth hormone, also AVP. The pituitary hormones will stimulate the adrenal and put the system into the sympathetic activity by secreting adrenaline as well as the cortisol. Everyone knows the effect of adrenaline and the cortisol on our each and every system. In the pancreas, the glucagon level will be high, it will be secreting more, and the insulin secretion will also decrease. Furthermore, the inflammatory and the immune mediators will act upon. Both these systems will separate, but they are also interconnected. These hormones will increase the inflammatory mediators, as well as the inflammatory mediators itself will stimulate this hormonal system. The acute inflammatory response is mainly activated through the cellular activation, mainly macrophage and monophages and lymphocytes. They will release the inflammatory mediators like tumor necrosis factor alpha and interleukin 1. These are the factors which release immediately after the tissue injury. These mediators will further increase the release of further mediators like interleukin 6 and so many mediators from the mast cells and macrophages. So all these things force the system into so many stress. So these mediators are either paracrine or endocrine effect on the system. The endothelium also have the effect of the stress response. It will also secrete the selectins, integrins, and ICOMs, and it will disturb the nitric oxide production from these endothelium, and the tissue factor is also disturbed. So the different levels of this pictorial demonstration of this metabolic response to the stress. After this stress, like trauma, surgery, and infection, the brain is activated. It will increase the secretions of the sympathetic hormones, which will lead on to the uncontrolled catabolism, and the cytokines and the mediators, which are released from the T lymphocytes, and the other inflammatory mediators also released, and they will also push the system into uncontrolled catabolism. The adipokines also released from the fat cells, and the GI tract hormones will also produce the resistance to the anabolic signal, which will alter the body composition. All this push the system into the increased energy expenditure and the increased substrate use. So what are the consequences of this stress response? So each and every stress response, for this stress response, our body is trying to limit the injury and initiate the repair process. And it will mobilize the substrate wherever it is stored, like glycogen from the liver and fat which is produced within the muscle cells. All the substrates are mobilized and utilized for these vital organs. And also the body imposes to prevent the infection, and finally the distant organ damage will occur, inability to cope up with the stress response. So the Cuthbertson first demonstrated the phases of this stress response of our body to the surgical or traumatic stress. These phases are F phase, followed by flow phase, followed by anabolic phase. These three phases will take over the process from the seconds of the traumatic injury. So once the injury occurs, within the minutes or seconds, the F phase starts. So it will occur up to the hours. It is mainly the shock. And the flow phase, it will occur within the days and will maintain with the catabolism by breaking down the energy sources and mobilizing the energy sources for all the vital organs. During the recovery phase, it will mainly occurs within the weeks. The anabolism starts and building up of the used energy will take place. These are the three phases will continuously run immediately after the injury. So the F phase is characterized by the hypovolemic shock. The priority of our body is to maintain the life and homeostasis. But in this phase, the cardiac output will be decreased, the oxygen consumption will be reduced, and the BP will be reduced. By that, the tissue perfusion also reduced. The body temperature go down and the metabolic rate also decreased. All these towards the shock. But our body is try to maintain the homeostasis by our counter-regulatory mechanisms. The metabolic response of the flow phase, there is increased counter-regulatory hormones like catecholamines, glucocorticoids, and the glucagon. And there is the release of cytokines and the lipid mediators, which will also play a role in the stress response of our body. The acute phase protein also enormously produced, and it will signaling the other tissues to meet out the stress response of this body. The catabolic elements of the flow phase is mainly the hypermetabolism, increased metabolism with the alteration of the skeletal muscle protein and alteration of the liver proteins. This will lead on to the increased insulin resistance. During the recovery phase, it is an anabolic phase which occurs at the 10 to 60 days, which will replace the lost tissues by anabolism with a positive nitrogen balance. In this phase, the growth hormone and the growth factors all are increased within the blood levels. This is the time for the F phase and the flow phase. Catabolism and the anabolism will take place at the end. So the metabolic response to the endocrine hormones, they will mobilize the sources of energy from the substrates. So the fatty acid is released from the lipid stores. Glucose is released from the stored liver and muscle glycogen. And the amino acids are released from the muscle amino acids. All these three, the glucose is directly utilized for the energy, and the fatty acid and amino acids will go through the glucose. So this is the simplest pictorial demonstration. From the fat, the lysis occurs and the glycerol is formed, and lipid peroxidases, all these enzymes, the lipid free fatty acids are produced. From the breakdown of the muscle, the alanine, glutamine, and other amino acids are produced. All these go to the liver for neoglucogenesis, and the glycogen lysis also occurs and produce the glucose for the energy substrate for main vital organs. This is mainly for the non-insulin dependent tissues like brain. If there is any hypoxic areas, the lactate is produced, that in turn converted into glucose through the neoglucogenesis. So during the stress period, the energy expenditure and the nitrogen excretions are enormously increased. For elective surgery, it was this graph shows the elective surgery will have a little energy expenditure as well as the nitrogen excretion than the major burns. followed by sepsis and skeletal trauma. So the nitrogen excretion is also a method. We have to assess the stress response to the injury. Likewise, we have to replace and we have to supplement the energy during the intraoperative and the postoperative period. So this is the substrate used, energy and substrate used during the early, late, and the recovery phases. Here, the pink is a carbohydrate, lipid, and blue is a proteins. During the early phase, there is increased amount of the carbohydrate is used mainly as the glucose, either in the form of direct form of glucose or the breakdown from the glycogen or the neoglucogenesis products, which will lead on to the production of glucose. The main carbohydrate substrate is utilized during the early phase of the stress, and the protein and lipids are utilizations are reduced. But in the late phase, the proteins and lipids are used little more, and the recovery phase, the three components are equally utilized for the recovery of the patient. So this is the enhanced recovery after surgery. So we have to follow this protocol even preoperative itself up to the postoperative period. The few points I will tell: the preoperative carbohydrate drink prior to the surgery will have an enhanced recovery after the surgery. During the surgery, the shorter incision like laparoscopic procedures, and consider the adequate volume and blood transfusion and good analgesia and good anesthetic techniques will have a good recovery during the postoperative period. During the postoperative period, the early mobilization, early enteral feeding, and the correct method of good analgesia will have a enhanced recovery also. So these are the methods to minimize the metabolic response to the stress. So they replace the blood and fluid loss immediately, even the preoperative period itself, but also in emergency situation and also during the intraoperative period. Foremost of our stress vest, and without the oxygen, the lactate and the system goes into the next level of inadequate fuel energy expenditure. So maintain adequate oxygenation and give adequate nutrition and provide adequate analgesia, both intraoperative as well as in the postoperative period. Avoid hypothermia. Hypothermia will kill the patient. The minimal access techniques like laparoscopic procedures will have a less stressor than the open procedures. So always advise the surgeon to go for a minimal access techniques. And the minimal periods of starvation and early enteral feeding will have a good results and early recovery from the stress period. Good epidural analgesia will have a adequate pain relief and will post the system with reduced stress. Even though the general anesthesia will have a good control of this, but combined epidural as well as the general anesthesia technique will have a very good results in controlling the stress response to the surgery. So we have to combine the technique. The opioids usually will suppress the hypothalamic pituitary axis and reduce secretion of the hormones into the systemic circulation. So the opioids will have a very good effect on suppressing the stress. With that good analgesia with the epidural technique, we will have a reduced stress response. Even though the epidural analgesia produce good stress controller, it has a very good effect in the lower abdominal as well as the lower limb surgeries. But the upper abdominal as well as thoracic surgeries will have a little bit reduced controlled response of the stress more than the lower limb surgeries. So these are the anesthetic techniques. So we have to select the technique for the particular patient, for the particular surgery. Likewise, we can reduce the stress. And early mobilization will have a very good results for both the patient confidence, but also the psychological factors, but also for the reducing the stress response. Thank you.
Thank you, sir. Thank you, sir, for a
Thank-
very short
thank you, sir.
lecture on a very broad topic, sir. Actually, it covers a lot of biochemistry, and we feel our field anesthesia has contact with all fields of medicine, especially because
Yes.
more of biochemistry, and it's a very tough topic to talk within a short period. I really thank you for a very crisp lecture and giving the vital things of this topic, sir. Next, we'll directly shall we proceed to the next topic, sir? We'll have the question and answer session at the end of the program, sir.
Yes, sir. Okay, sir.
Yeah. Now we are proceeding with the topic that is going to be presented by the resident, cardiac resident at Meenakshi Mission Hospital, Madurai, Dr. Vigneshwaran is going to talk about stress cardiomyopathy and its perioperative implications. This is upcoming topic as an obstetrician. Obstetric anesthetist is working at ISO KGH. We regularly come across this case very silently now being presenting, and many of our anesthetists land in trouble when giving anesthesia to this type of patient. Now over to Dr. Vigneshwaran.
Am I audible, sir?
Dr. Vignesh, you can start your presentation.
Am I audible, sir?
Yeah, yes.
Yes. Sir. So, good evening, everyone. So, I am Dr. Vigneshwaran. So, I'm here to talk about stress cardiomyopathy and its perioperative implications. So, as the name suggests, it is mediated by the stress, any form of stress, can be a physical stress or an emotional stress, or it can be a mental stress. So, what do you understand by that? So, it is an acquired type of cardiomyopathy. What it does the left ventricle to dilate, and it leads to transient acute heart failure. So, what is the causative factor is the high concentration of catecholamine in the circulation. So, this is the main factor. So, this is what you understand out of stress cardiomyopathy. So, coming to history, the stress cardiomyopathy was reported as Takotsubo cardiomyopathy first time in Japan, late 1990 by Hiraku Sato. But this fancy diagnosis did not gain much importance afterwards. But after a series of earthquakes, which happened on 2004 and 2014 in New Zealand and Nikita, Japan, many of the people came with the transient cardiomyopathy and they were going home after discharge. And retrospectively, they found out that this could be the reason why the people are dying. So this is how the topic gained very much importance. So as I told you, can be due to a lot of factors like physical stress. The most common type of physical stress, as the sir discussed, would be surgery or a patient in respiratory failure. Most common sepsis or a major head trauma or major infarct. Or can be an emotional stress like losing a loved one, death of a person, and any preponderances, like it's most common in males, and it is also most common in women. Therefore, stress cardiomyopathy, there should be a trigger. There should be a trigger, but it is always missed. So the trigger will happen always 0 to 4 days before the symptoms. So as I put it in a nutshell, the physical trigger amounts to 52% of the cases, and the emotional trigger will amount to 31% of the cases. Sometimes the trigger cannot be identified in terms to 17% of the cases. So what is the prevalence? Among the suspected acute coronary syndromes reporting in the casualty, 2% of them will be a stress cardiomyopathy, and 95% of them will have a good recovery of cardiac function when they are properly identified and treated, and they have an in-hospital mortality of 5%. Therefore, how do you diagnose them? So this is a criteria, so by which you diagnose. It's a revised Mayo clinical criteria. It has 4 elements, and the first element will be to diagnose stress cardiomyopathy. So there should be an abnormal mobility of the left ventricular mid-segment with or without involvement of an apical segment. And there should be regional wall motion abnormality that should extend beyond single epicardial distribution. And the stressful trigger is often present, but it is not always. And second one, it is absence of obstructive coronary artery disease or absence of coronary plaque rupture or atherosclerotic plaque rupture, and that should be angiographically evident. Third thing is any ECG abnormalities which are suggestive of acute coronary syndrome. And third thing is with elevation of cardiac biomarkers. And the last one is absence of pheochromocytoma 1 myocarditis. It's a diagnosis of exclusion. You have to always exclude pheochromocytoma 1 myocarditis. Therefore, before we came into this, there were myths. Actually, they were proposing that before stress cardiomyopathy, there were clot inside and it got dissolved afterwards. But in Germany, this study changed the fate of diagnosis, and we had a better understanding about the stress cardiomyopathy, that it is not due to coronary artery rupture. It is not due to any coronary artery rupture or plaque that is structured. By intravascular ultrasound, you can see normal epicardial coronaries here, and you can see normal lumen of them even. So they went to ventriculogram in cardiac catheterization, and they found out there a significant pattern of the left ventricle in the shape called as the basal segment. You can appreciate here, it has contracted much. Whereas if you see the apical segment, it has ballooned. You can see it here. So this is analogous to the shape of a pot. This is called as octopus pot. This octopus pot is actually a trap used by Japanese fishermen to catch octopus. So they named it as Takotsubo cardiomyopathy. So this is how the name came. So now we have to understand why such a pattern happens, what is the underlying mechanism is inside it. So you have to understand what is the histological distribution of autonomic nerves in the human heart. You can see the first slide. You can see the distribution of adrenergic receptors in the basal portion of the heart, in the left ventricle, and the apical portion of the left ventricle. You can see there is a good distribution here in the apical portion, whereas you can see a very sparse distribution in the left ventricle apex. So now you know that the basal segment, they contract better for the demand, whereas the apical segment, due to the sparse amount of the receptor, adrenergic receptor which are present, they yield. Therefore, we have apical ballooning. Therefore, we have morphological variants. 75% to 80% of the cases we have apical ballooning, so it is called as apical ballooning syndrome. 20% of the cases it has mid-ventricle ballooning, and remaining they have rare cases, they have anomalous presentations. So clinical presentation, we have mainly two arms of presentation. One is a transient left ventricular dysfunction after acute emotional or physical stress, and the second one is left ventricular dysfunction associated with any intracerebral events like coronary hemorrhage or stroke or trauma. So it is called as neurocardiogenic stunning or neurogenic stress cardiomyopathy. So first one we will discuss about it. So what is the mechanism? So when we come out the adrenergic receptors in the heart, we mainly discover the beta adrenergic receptors, and we have two catecholamines. One is norepinephrine, other one is the epinephrine. So norepinephrine, on physiological concentrations or high concentrations, it acts on the beta 2 adrenoreceptors, and it signals via the GS protein family. And that's why it increases the contractile response. Whereas if you see epinephrine, in physiological concentrations, it also acts on the beta 2 adrenoreceptor and also signals to the GS protein family and increases the contractile response. But to cardiomyopathy has to develop, we need something called stimulus trafficking. So the trafficking usually happens physiologically via GS family, but the stimulus trafficking means GS family should be replaced by GI family, this inhibitory family of signaling. So when epinephrine, during the stress cardiomyopathy, with increasing concentrations, they act both on the beta 1 and beta 2 adrenoreceptors on the ventricle. When the signal is received via the beta 1 adrenoreceptor at high concentrations, now the stimulus trafficking happens from GS to GI. Now the decreased contractile response happens and the cardiomyopathy manifests. So this is the main thing, this is the stimulus trafficking in the mechanism. So in the second one, the LV dysfunction, which is associated with the intracranial hemorrhage or stroke, the name suggests it is due to any major trauma, which can be an infarct or an hemorrhage, can be a surgery, or can be an epilepsy. So anything that increases the intracranial pressure and affects the insular cortex and amygdala and causes the autonomic output from the central nervous system, thereby increasing the catecholamine excess, thereby manifesting the calcium channel activation and spoils the mitochondria of the heart and manifests like an acute coronary syndrome. So the three main mechanisms, whatever may be the clinical presentation, the three main mechanisms which we say is, one, it is due to epicardial coronary spasm that causes myocardial stunning. And the second, it is due to coronary microvascular dysfunction. And the third one is catecholamine mediated direct myocardial injury. So whatever may be the clinical presentation, These are the three mechanisms that is ultimately going to affect the heart. So now we have a stepwise approach, management approach. When any patient comes with acute coronary syndrome, with ECG abnormalities and increased cardiac enzymes and chest X-ray, we always go to transthoracic echo. In transthoracic echo, if you see regional wall motion abnormalities, you can go to coronary angiogram. And here it is, you have to notice there will be a normal coronary epicardial vessels. If there is a normal epicardial coronary vessels, always have a diagnosis that Takotsubo cardiomyopathy could be there. So next thing you can go to left ventriculography. So there you have to see octopus spot appearance. There you have the diagnosis. So how do you treat the patient? When treating the patient or approaching the patient, you segregate them. If the patient is hemodynamically stable, you treat them as systolic heart failure patient. So you can treat them with diuretics to relieve the pulmonary congestion, vasodilators to reduce the preload, AC inhibitors to reduce the afterload, and with beta blockers. Suppose if the patient is unstable with cardiogenic shock, you have to rule out left ventricle outflow tract obstruction. It's very important. When the left ventricle dilates, what happens? The mitral valve annulus dilates, and the anterior leaflet of the mitral valve will swing and come in the way of left ventricle outflow tract. So when the basal ventricle is contracting much, it could increase the obstruction of the left ventricle outflow tract. So always rule out the left ventricle outflow tract when the patient is in cardiogenic shock. And when the patient is in the cardiogenic shock and left ventricle outflow tract, ionotropes should not be used, because ionotropes will still increase the basal contractility and further worsen the obstruction. Therefore, use the beta blockers and give IV fluids and try to open the left ventricle outflow tract to get the systemic output, and use vasopressors to maintain the afterload. And if the patient has no left ventricle outflow tract obstruction, you can well go with the ionotropes, vasopressors, and if the patient is still refractory, you can go with left ventricle assist devices and ECMO. So in a nutshell, so what we gain, when the patient has no left ventricle outflow tract obstruction, to decrease the preload and decrease the afterload, aim to get a forward flow outside the heart from the left ventricle, maintain the contractility and heart rate, and maintain the pulmonary vascular resistance. And if the patient has left ventricle outflow tract obstruction, increase the preload, maintain the afterload with vasopressors, avoid tachycardia, and maintain the pulmonary vascular resistance. Therefore, what are the things we have to monitor here? When the patient comes to cardiac surgery or non-cardiac surgery, you always monitor for perioperative MI, cardiogenic shock, mitral regurgitation, LV clot, arrhythmias, AV dissociations, blocks, heart failure, and importantly, cerebrovascular accidents. Therefore, intraoperatively and perioperatively, what are the goals we have is adequately pre-medicate the patients to relieve the anxiety, attenuate the intubation response, maintain adequate depth of anesthesia, adequate preoperative anesthesia should be provided, upturn the extubation response, and always use anticoagulants because they are more prone to go for ischemic infarcts. So what is the recurrence and risks? I have told them 95% of the patients will recover from the condition with good ventricle output, but the annual recurrence is always there with 1.5%, and cumulatively up to 6 years can say the recurrence will be 5%. And you have to know that one condition is an independent risk factor, which is atrial fibrillation, which always increases the mortality in these patients. Thank you.
Thank you, Dr. Thank you, Dr. Vigneshwar. It's a really eye-opening lecture. Being in obstetric center attached with MMC, we frequently come across these type of cases, which is very silent. Most of our doctors, they land up in trouble when they give anesthesia for these cases, especially when they are doing sterilization procedures at the PHC level. And nowadays, we stress upon going for a echocardiogram for all the patient at least once during when they are pregnancy, during the pregnancy time. And we stress upon it, and this is being very much followed in Chennai Corporation. All the ladies who are pregnant, they undergo echo at least once, so to find out. And the things you told about how to manage during an outflow tract obstruction, and when there is no outflow, where should you use a vasopressor, is very important. It's a very good point to note, and given a very beautiful lecture, a very detailed one. Thank you very much. And now we'll go for the most important and the most awaited lecture by Dr. Ashok Deshpande, sir, because what we have till now discussed is about the science of managing stress. Now we are going to the other side of the managing stress. We are all waiting for Ashok sir for a lecture. Now I hand over the session to Dr. Ashok Deshpande. Sir, are you there, sir? Sir, Dr. Ashok sir.
Sir, Deshpande sir.
Sir, is there, sir? He has to unmute his thing, sir. Sir, can you unmute, sir?
Yes, sir. Good evening, everybody.
Yes.
Yes, sir. Now,
Sir,
all of them are waiting for your lecture, sir.
Screen.
Please take over the session, sir.
Off his screen. I had to share my screen. He has to off his screen. Yeah, I will share my screen. Okay. Good evening, everybody. And this is the 47th webinar from the ISA Pudukkottai. And it's really a great thing that they did 47 in a year. Is not a joke. It's a troublesome part, stressful part also. Dr. Suresh Kumar, President, Dr. Periya Swami, Secretary, Dr. David, Treasurer, my friend Dr. Bhaskar, and the first speaker to whom I have met for the first time today, and that is Bal Subramani. And today we have got a God with us, Dr. Vigneshwaran. So there has not to be failure at all. So God is with us. And above all, my best friend, Dr. ALM. We are together for last 25 to 30 years, and we enjoy every now and then our meeting. So am I audible, and may I start my today's lecture?
Yes, sir. You are very much audible, sir. You can start,
Thank
sir.
you, sir. I'm going to talk today on history anesthesia practice. And this has got no references. The reference is my life practice. That is the only reference. And from that, I had prepared this lecture. Someday morning, I had seen a picture like this on the road when I was going for a cesarean section. Who is at stress, myself or that driver? I think driver is not at stress. He knows everybody will go out. Nobody will come in front of my truck. So that's the things which happens. Now, what are the basics of the practice? You have to have a good qualification. DA,
Sir,
MD,
excuse me, sir.
ITCCM, etc. Whatnot, all these things. We have got so many qualifications now.
Sir, are you sharing? Sir, excuse me, sir.
Yeah.
Pardon for interrupting, sir. Are you sharing your thing, sir?
Yeah.
We are actually we are unable to see anything on screen, sir.
Wait. I will do it again. I'll do it.
Yeah, yes, sir.
Deshpande sir, you can increase your decibel also.
Sir, what's the problem? It is not getting shared. What is the reason?
Sir, we can do other thing also. Can you share your PowerPoint to me to directly to the A1 Logistics, so you can just prompt the next slide so that they will do the job. Is it okay, sir?
I had to share my to A1 Logistics, but how to share
you
that?
can. Okay, you send your PowerPoint to me, sir. I'll share them.
To you, but how I will send it to you?
Sir, Dr. Deshpande sir, last week you have done. So you please do the same. Oh, he was not sure. Sir, you opened the PowerPoint, sir.
I opened my PowerPoint.
Then
sir,
you go for slide.
Browser. I have joined from the browser, and browser is preventing me from.
No, you go for share screen, sir.
Huh?
You go for share screen option.
I have gone for that. I am pressing
Then
that continuously.
Two icons will be seen, sir. One is your PowerPoint, another one is slideshow. So you have to click the slideshow. Yes.
Yes.
Sir, now you have to open the PowerPoint, sir, first. Then only you have to come for this.
Okay. I opened it up.
Yeah, you open the PowerPoint first.
I will go for slideshow.
Then go for slideshow.
And now,
Then share. That icon is not appearing now.
I am not seeing my screen on that where I have to make it share. Or I'll join again.
No. Sir, one second.
One participant can share at a time. I think somebody
Yeah.
has not closed the screen.
Oh, then Dr. Balasubramaniam, you have to exit.
Balasubramaniam has not closed the.
No, Vigneshwaran, Dr. Vigneshwaran.
Yes,
I am
sir.
seeing the name of Dr. Balasubramaniam here.
You have stopped the screen share.
Yes, I have stopped the screen share, sir.
Sir,
But
then
I'm
you have to again check, sir.
I stopped, sir. I
I
stopped
am
it.
seeing his name here. On my screen, I am seeing his name.
This is really a stress, sir.
This is a stress for all those who want to listen that. Sir, what is to be done?
One second. Sir, you
Yes.
please share it to me, sir, by WhatsApp or mail.
WhatsApp.
Shilpa, Dr. Ashok Deshpande could not share it.
I am seeing on my screen Dr. M. Balasubramaniam T. I think he has not stopped his sharing.
I have stopped, sir.
But I am seeing his name on my screen. How is it? It should be clear screen.
Shilpa, can you just make sir alone, Ashok sir alone, the co-host?
Dr. Bhaskar, I called her. She's on the travel, but Dr. Balasubramanian, you please exit, then the job will be over. Dr. Balasubramanian. Dr. Balasubramanian.
Sir, I will call him, sir.
One second, I will call him and say.
Yes, sir. I will exit and I will join, sir.
You
Rejoin. I will leave
exit,
and
yeah.
rejoin. Okay, sir.
Yeah, you try. We will even that will not solve the purpose because
Okay.
Dr. SAR's screen is seen. Yeah, you exit.
Okay.
You exit. Now
Yeah.
you check, sir.
Now I will try. My browser is preventing to access to your share screen. So I think I have to join it again. Not through browser, but through the.
No. What is the problem?
I am seeing ALM now. ALM Meenakshi Sundaram.
No. That is speaking, sir. I am speaking.
Okay. Then what is the problem? I am not able to. I think I will join again in a minute or so. Will that be okay? One participant can share at a time. That is what I am getting. But I am not getting that screen. ALM, I think I will join again. I will get out and I will join again. Let me see.
Sir, where you? One second, sir.
Yes, sir.
So you're being made a co-host.
Yeah.
Then things should be available. Suresh Kumar is a co-host.
All
Myself.
permissions given to him.
Yes, sir. Everything is being given.
But I am trying to share my screen and I get a message that your browser is preventing access to your share screen.
Then sir, you send your sir. You send your PPT to me, sir, by mail.
By mail. Give me your mail address.
DRAL.
Your mail address.
DRAL. My name, DRAL Meenakshi.
Wait, sir, wait. I will write it.
At gmail.com.
DRAL. Meenakshi.
Same name, sir.
NEENA. Yeah. At gmail.com.
At gmail.com, sir.
Okay, sir. I am sending. Okay, sir.
You send it and you exit and join.
Okay.
Till that time,
Sir, Ashok sir, I guess have you installed the Zoom in your laptop or have you joined through browser?
No, I have Zoom also.
Huh?
But it was not possible for me to join through Zoom, so I joined through browser.
no,
Sir, that's
So
what
I
it
will
is not
send it to
allowing. You
Meenakshi.
have to.
I will
Sir,
send
you
it to
have
Meenakshi.
to.
Okay. I will send it to
sir,
Meenakshi.
you have to
Yes, sir.
install Zoom in your app, sir.
I have got, sir. I have.
Then you have to enter through Zoom app.
Okay. Wait a minute, sir.
If you are entering through browser, it means you are joining as a delegate.
Okay. Sir, wait a minute. I will.
Sir, once you are ready, you tell me, Dr. Bhaskar.
Yes, sir.
Yes,
See,
sir. Yes, sir.
when Dr. Balasubramanian has delivered a wonderful lecture, because when I was teaching my postgraduates, I used to do that, which I want at least all the teachers to practice, because what we have taught, our preoperative assessment, we never taught about EP phase and flow phase. Whenever we are assessing a patient, we have to assess whether the patient is fit enough to face the flow phenomena, because the first 2 days everything will be all right. Only at the third day the patients will develop infarction if they are elderly. Ischemic heart disease patient, during surgery they will be fine because anesthesia will be by the side, all the drugs will be available. Only when the flow phenomena occurs the patients suffer. Usually what happens, even if it is a CA breast elderly, we anesthetize, he will we will awaken the patient, he will opening the eyes, we will leave. But only on the third post-operative day, all the problems will come. And mostly it will be blamed on the surgical part. But what I want to convey, we have to assess whether the patient is able to face the flow phenomena for the simple reason. Now, we are telling if the hemoglobin is less than 10, you reject the case. But the case may be even a removal of sebaceous cyst or it may be a hemorrhoidectomy. So we have to teach the postgraduate the hemorrhoidectomy will not produce a flow phenomena like a gastrectomy. So the patient will face the flow phenomena on the third day. So it is not the hemoglobin that counts. Hemoglobin we are checking because elderly patient, when the flow phenomena is peak, hemoglobin is less, they will develop infarction. So if the anemic patient posted for CA breast or CA stomach, it is different from a sebaceous cyst or hemorrhoidectomy. But unfortunately, as the assistants and the chiefs are not entering the assessment room, the postgraduates are writing right and left. Hemoglobin is 7, rejected. Hemoglobin, see, it may be a puerperal sterilization. That is a common area, and we blame. We are governed by government rules and regulations. So hemoglobin is less than 10, we cannot take. See, the hemoglobin is less than 10 is the idea to face the flow phenomena. But what is the big thing it is going to happen? Unless or otherwise it is extended to a laparotomy, that hemoglobin of 8 will not do any problem. So when you are assessing, you please assess with reference to the flow phenomena and not just by numbers, because I will be putting it point blank. If you are assessing by numbers, a human being is not needed. We can place a robo, you can check in your detail, the robo can reject hemoglobin less than 10, BP less than 1. But the same thing happens for hypertension also. If a pressure of 160, 100 posted for herniorrhaphy is different from a patient posted for thoracotomy. So the amount of phase, even laparotomy produces more danger than thoracotomy as far as this flow phenomena is concerned. So with that idea only we have to analyze, and really it was a very good lecture, Dr. Balasubramaniam lecture. Even I wanted him to write it as a notes so that it can be circulated, and all the surgical people should listen to him because it is a coverage. He has given everything. So that I wanted to add in this gap. It is a gap analysis. Same way your cardiomyopathy also. He has given a good amount, and as you are in OBG, it is applicable to your department.
Yes, sir. We come
Sure.
across lot of cases like this, sir. People unsuspected, they land in trouble, and many mortality. Certain times it even goes up to the level of mortality. definitely cardiomyopathy has to be ruled out, sir. It has to be taken.
And another
upon.
thing, but see, don't make it as a rule that all patients should undergo echocardiography.
Yes,
That
sir.
will
We
increase the load, but I was assuming that it is not the case. See, patients may develop, just because the patient may develop infarction, we cannot take a ECG for everyone, even 15 years or 20 years. It cannot be like that. See, it can happen only if it happens, because see that then the load will be phenomenal on the part of the cardiologist. How
Yes, sir.
all the patients, all females will become pregnant one day. Then imagine all the females undergoing echocardiography. It is not possible. See, when the patient deteriorates in the postoperative period, previously we were never thought of cardiomyopathy. Now we are thinking that.
So the other thing, what I have been thinking is like, is it possible to ourselves doing a focus, something like that, a bedside echo, and coming out on some conclusion regarding the
See,
cardiomyopathy, sir? Is it
actually
acceptable?
now imaging is done by anesthesiologist. Like your echocardiography, we are doing only transesophageal echo. If you want to do that, you can do. But what I want to convey, nothing can be a routine. We cannot say routinely you do that. Then I used to say, when I am teaching my postgraduates, when they say routine, because investigation they will say while presenting, investigations are routine investigations like TCTC. I will not accept that. They have to say why they are doing hemoglobin. It is not be a routine. So if you are examining routinely, you routinely assess whether the patient is having 10 fingers or not. Routinely, you assess whether he has two limbs or not. So nothing could be routine in assessment. You have to assess that because the words have become very casual. So routine, same way blood urea sugar creatinine has become a routine. Nothing is routine. Everything should have a meaning, because
Sure,
in a
sir.
private practice, if you write routine, the patient is going to spend for that. So whatever you are asking, it should be praiseworthy. So that is my concern. But today it should be eye-opening lecture. At least from tomorrow onwards, the anesthesiologists who are doing the assessment, they should fairly assess all the cases. In that sense only, I will not reject any case, because just to analyze whether it is worth doing or not. Mostly that case we will not fail. Mainly the cases undergoing regional anesthesia, that is spinal epidural, we will
Yes,
not
sir.
fail in the third, because it will cut down the pain also, that will cut down the endocrine response. But in that way, all the teachers should teach the postgraduate. But unfortunately, even some postgraduates trained under me, now they are chiefs and they are rejecting the case. That is the fun of it. See, I wasted a whole lot of time to convince the people, but even they are straight trained under my nose, they are doing it. And they say, sir, medico legally, we will be getting caught, sir. Sir. These are all only escapism, way of escapism. Even I am also doing the same thing. Medical legal is I am also responsible. Same laws applicable for me, but just to escape, we are using it as a tool. Deshpande sir, you are ready? Deshpande sir, actually your slides will be very nice.
Able to share, sir.
Sir, I send you my slide. Oh.
Sir, opening your slideshow, sir.
Send it to me. I will try to open.
Yeah. I send it to you. I send it to you.
see?
Yes, sir, we can see, sir.
You can see the thing?
Yes, sir, very much, sir. Sir, can we go for a screen share?
Slide show. I'll go for slide show. Just wait. Okay. Bhaskar,
Not seeing,
now? Seen or not?
no,
Yes, sir,
I'm
visible.
not seeing it.
Sir, we are able to
What
see,
is the
sir.
problem?
It's visible, sir.
Dr. Bhaskar, is it visible?
Sir, very much visible, sir. Very much visible, sir.
Sir, Deshpande, sir, you talk according to your screen. I will change the screen here. Got the point, sir?
I will talk. Yeah, I will talk. You can listen me?
Yeah, but now what happened to my slide screen?
Sir, we are unable to see, sir.
One second. Now it is seen, na?
Yes, sir. Very much, sir. Clearly seen.
Sir, Deshpande, sir, you just talk, sir. I will
Yes,
change
sir.
the slide.
Okay, sir. Okay.
Now I'm standing in when to
Yes.
stop. So you have to talk that because I don't want to again trouble the thing. You please better stop after 35 years of practice. What is that? It is beginning or not?
We will start it from the beginning.
1 second, I'll go for the beginning. Yes, sir. Now it is your introduction, sir.
No, next slide, sir.
Now it is stress-free anesthesia practice, sir. Now a lorry is carrying a bag load, sir.
Yes, sir. Sir,
You
every-
tell me,
for
sir.
every
Next
picture
slide.
you have-
Next slide. You tell me, sir. I will change.
For every picture, sir, you have to press that.
Yeah,
Then
yeah.
only you will get picture.
Yeah,
I will
you
say
please.
press. Then only. Okay, sir. Yeah. So I'm sorry, something wrong from my side. Today I'm going to talk on stress-free anesthesia. I hope I am audible to everybody.
very much
Increase
clear,
the
sir.
increase the
That's clear.
decibels a little bit. Like Dr. ALM.
Sir, it is on the top mode. It is on the topmost part.
Ah.
So one day morning when I was going for a call, I have seen a lorry like this, and I have to go by the side of that without dashing that particular part. And there the stress started beginning. But the driver must not have any stress because everybody sees it and goes by the side of that. Sir, next slide, please. What are the basics of practice? Qualification. You have to have a good qualification. DA, MD, DNB, ID, CCM, etc. And a choice of place. You have to do a choice of place. Either a medical college to join or a place somewhere you want to do your freelancing. And you have to also see that how much population is covered by that particular city. It should not be nearer to the big city. So next slide, please. I have found out the stages of practice. There are 4 stages of practice. Stage 1 is from your day 1 to 5 years. Stage 2 is from the 6th year to 10th year. And stage 3 is known as the golden period of your practice or golden period in your medical college, where you must have reached to the professor level. And that is from 11 years to 25 years, where you earn your maximum amount in your life. And stage 4 is from 26 to 35 years, next 10 years. Now, these are the stages according to my thinking. And one has to think also, so next slide, please. When to stop? When to stop? Better to stop after 35 years of your practice, because by then you have reached to 65 or 70 years. See, most of the times, old surgeons are preferred than old anesthesiologists, because the surgeons say that his reflexes are sluggish now. And you have to accept it also boldly. I stopped my practice once I finished my 65 years, I stopped it. I went in something else. So this is how you have to do it. Sir, next slide, please. there are point of stress, and what are they? So you have to find out how many number of anesthesiologists are there in your department or in your city, and what are the number of surgeons there in the city practicing. Includes all surgeons. And from day one, you may be third or fourth in the list of the nursing homes. So you naturally get a little bit stressed, but there is nothing to worry about it. Day one is always written in everybody's life. So next slide, please. See, your practice or your practicing in the medical college should be target oriented. What are the targets? Earn money, have a good wife, have property, have a good house, have kids. Education of the kids, they should learn nicely. Then admission in the school or colleges which are reputed one in that particular area. Courses according to their desire, professional or non-professional, UG, PG, super specialty and settlement, and wife. See, wife is the important part in your life. She will reduce your stress most of the time. Sir, next slide. It is difficult to make a hole in the nest of your own colleagues, because your own colleagues in the city are there or in the medical college are there who are in good reputation with the surgeons, but you have to put your own name also. So you have to make a hole in the nest of your colleagues. Sir, next slide, please. Now, most of the times we compromise in the early part from 0 to 5, compromise with the situations to earn the name. Less investigations will do, I will do it to earn money. Qualification matters sometimes because there are so many quacks working in so many cities. And most of the times they go and do the cases. When you refuse it, something happens, they manage it. Sometimes there is junior syndrome. He is a junior, don't call him. So you have to compromise so many times, but do not compromise to a dangerous level. Sir, please press for the picture. But do not compromise to this level. Knowingly or unknowingly, please do not compromise this level. So I hope you are seeing the picture also. The next slide, please. Understanding has to be there, and to understand the surgeon or his or her likings, if you know that how he likes it, how he likes the patient, then your life becomes easy and the surgeon's life also becomes comfortable. You are in good term with the surgeons and you get a good name also that he manages nicely or something it is good. There's something like that. The next slide, please. What is very, very important in your practice, mostly private practice, is that never give first call to plastic surgeon. I have committed mistakes 3-4 times and then I have learned it. I have never given first call to plastic surgeon because they always think of the cosmetics. And you know that. See, he will put 2 stitches. He will say those 2 are not good. He will put 2, he will remove 4. So every time your stress goes on increasing and you are late for the next case. So never give first call to your plastic surgeon. Always give him in the afternoon. You should learn new things. So next slide, please. You should learn new things and you should be boss or you should be expert in the specific field. Say peripheral nerve blocks or any other thing like that. TEE, whatever it is, whatever technique you want to learn. Learn new techniques which will suit to your place. If you go to the conference to Bangalore and they are doing something else there, you want to do it in your Pudukkottai, it is not possible. Please don't go for those techniques. Go for the techniques which are suitable to your own place and be expert into those techniques. Attend the conferences for knowledge, of course, for relaxation, sightseeing also once in a year, so that it reduces
Sir,
your stress.
One
of your-
second. Sorry, Dr. Deshpande, sir. Sorry for disturbing. Now the
Yeah.
slide is not moving. I will again slide share. Just a second. With the plastic
Yeah.
surgeon, the slide is not moving for me. Once again.
Okay. Yeah.
I will again share.
Okay.
Now it is seen, sir.
It is seen, sir.
Yeah. Now he will put two stitches and will remove 4. It has come.
Yeah, it has come. Okay, sir. Okay.
So next slide I have to go. Learn new things.
Yeah, next slide, sir. Next
Learn
slide.
new things. Then now your first call must begin in time.
Yes, learn new things. Be expert in the specific fields. Learn new techniques which will suit to your place. Because once you go somewhere for the conference, say at Bangalore or at Hyderabad, and you see so many new things, and you are tempted to start those things, but at a small place or at a place like Sangli or so, we cannot do those things. Therefore, you have to learn the new things and become expert in the techniques which will suit to your place. You should attend the conferences for knowledge, relaxation, and sightseeing once a year. So next slide. Most of the times when you go for the first call, it must begin in time so that it will not produce stress to you. For that, the foremost and important thing is that your car should be fit. You should do regular servicing of it, put petrol every week, and check air pressure every now and then. If there is a puncture when you come out of your house, it goes on increasing the stress. The next slide. Give helping hands to your friends. So press it for picture. There are 3 pictures in it. Give helping hand to your friends. If somebody is in difficulty, go and help them. Don't neglect that. Teach your juniors how to do the things. Do not defame your juniors. Do not defame your colleagues, but try to cover them. By some or other, try to cover them. Try to bring them out of the difficulties. Give respect to your own seniors. And please do not demand the respect. You earn your respect yourself. Sir, next slide. PAC is the important part of everybody's life. Pre-anesthesia checkup is a must. It prepares your mind. Keep your own record if required. You copy to the surgeon of the PAC because nowadays there are so many things about the PAC. Sir, please press for the next picture. See, sometimes I had seen it picture like this. If I had seen it without PAC, I would have been in the stress. So it is better to go for PAC. When you are going for PAC, purposefully go late. I used to go late. Let that sister from the nursing home call you 2-3 times. Sir, when are you coming? When are you coming? Let relative also know that Dr. Deshpande is coming. Dr. Deshpande is coming. And your position is like this then. Sir, next slide, please. And again for the picture. It is like this. Anesthesiologist is coming. You have to go very slowly you go. But not too late also. Slowly you go. You behave there like a king. Even if you don't understand anything, don't show in front of anybody. You can take the help of your colleagues later on. Now, there are so many times we are under the stress for the vocal cords. And later the stress is relieved. Sir, please place for the picture.
Yes, sir.
And I hope most of you. Yes, sir.
Pre-anesthesia check.
Picture, sir. The next one. Next slide, please, sir.
People. Sir, pupillary reflex have come. Even you can see in your screen, sir.
What? I will see it in my screen.
Sir, you need PAC or what?
Wait,
Sir, we can go for the next. Every slide, every enter you press, the next picture will be coming, sir. That is the way as I prepared as PPT, I presume, sir.
I have done that.
Yes, sir. Yes, it is coming, sir. It is coming, sir.
Sir,
it is not visible on my screen.
Whatever I am moving, it will be visible on your screen.
No, I am not seeing it. I am seeing only AL Meenakshi.
Sir, now, sir, you talk as per your norm, sir, I will change. You just check in your laptop. Now, the helping hand is there.
From my laptop, from our presentation.
Sir, now helping
Or
hand
should
is
we
there.
do it some other time? Or sir, my request is we will do it some other time.
Yeah, then it is right. Sir, now the PAC is coming. Now the PAC is coming.
Okay. You are seeing the PAC now?
Yeah.
Okay, sir. Press once again. You will get a picture of.
Yes.
Sir, that is the picture which I had seen it in one of the lady, and it was really exciting for me. I had never seen in my lifetime. Whenever you go for the PAC, you go purposefully late. I used to go late. Let patient come to know my name that Dr. Deshpande is coming. Dr. Deshpande is coming. I purposefully go late. And you should go like this. Sir, next slide, please. Press once again. That should be your role, sir, going for seeing the PAC. Like a lion, you should go over there. And everybody should wait for you. And you should be there after half an hour also. Sir, next slide, please. We got always a stress after seeing every patient. And there is a stress reliever for us who has given us something in our anesthesia practice. Sir, place once again for the picture. And this is the picture of somebody I think everybody knows who is he. He is Dr. Malampatti. He has relieved the stress of most of us for the vocal cords. Sir, next slide, please. Consent and risk. You have to tell about the anesthesia risk yourself. Please do not believe on your surgeons that they must have told the risk to the patient. Be cautious about the consent and check yourself the consent. Sir, next slide, please. Notes and post-op visits. Those are important nowadays. And see what is the position of the endotracheal tube. This I had removed it from one of the ICUs. These tubes, how they are clogged with the clots. And I have mentioned it on the papers. And post-op visit will tighten the bond between you and the patient. So you have to visit post-operatively to the patient. In case of complications, you must visit ICU and CCU every now and then. That will develop the bond between you and the patient. So next slide, please. Keep one assistant with you. He should drive the car also. Keep all emergency drugs with you. Even though most of the nursing homes have it, please keep one set with you. You trained your driver for helping in OT also, and he does other works also in your house, so that it will be easier for you. You don't have stress. Otherwise, your wife calls you, I have to go for the marriage, come back immediately. So that type of stress is not there. So next slide. What are the techniques to reduce the stress? One is go in time. Inform earlier if you are getting late. Inform earlier to the patient, otherwise you are always in stress. So better relieve the stress in that particular way. If not, if you cannot go, ask the surgeon. Yes, sir, any problem?
Yes, sir. You can
Yes, sir.
proceed, sir. You can proceed, sir. You can proceed.
Yeah. If you cannot go to the case, you can do the case. You can ask them to do the case with your other friend, so that it will be easier for you also and for surgeon also. Please do not go for the WhatsApp or phone calls when you are doing any case. Be busy with the patient. That will reduce your stress. Next slide, sir. You have to judge the speed of the surgeon also for giving next call. And nowadays, most of the surgeons, son or daughter is getting medical graduates, getting surgeon or obstetrician, and they train them in their own nursing home, so that your stress goes on increasing because you have to go for the next call. So you have to judge the speed of the surgeon and other things also. So next call. You have to do a cool practice. You have to keep average number of calls every day. Do not keep very rushing calls. Just one after the other in a half an hour distance. Please don't keep that. Keep sufficient time for every call. If there is a VIP, sir, please praise that. One more anesthesiologist for VIP. And do not fight amongst yourself for call. Absolutely not. See, if you lose one call, it hardly makes any difference, but do not fight with each other. Call some physician for complicated cases. Do not take that risk at all, so that don't increase your stress. Sir, next slide, please. For pediatric cases, you have to give more time. You always keep more time for the pediatric case, even if it is a short case. Because pediatric, the safety margin is less. Do not leave the baby unless the baby is completely out of the anesthesia procedures. Unless the vitals are safe. And explain the problem which the baby can face after coming out of that to the relatives, so that your stress is reduced. Next slide, sir. Do not go for favorism to the surgeon. I have never gone for this. I had seen so many of my colleagues doing this, and those are the signs of favorism. Start the suction, adjust the light, tell the amount of urine, whatever it is. This does not work at all. Do not do extra work for the surgeons. Because if you are out of the station, no surgeon waits for you. He will do his case. So do not do extra work at all. So next slide, please. Do not go to the smart obstetrician every day, because your wife and her husband is hurt every day. So better sometimes in a week you tell that you are busy and please do not go to them. This creates unnecessary stress in your family. So next slide, please. Care for your wife. Important part, very important part. Pamper your wife. Go for outing with them to reduce your stress and her stress also. Get your wife with you in all receptions, in all marriages, in all functions, so that your stress is reduced. Your wife is with you, she will not object anything. Next slide, sir. Female critical care starts in the house only. Respect your wife. And you know that your wife's brother, sister, and parents are most VIP persons. Do not neglect them. Arrange a vehicle and a driver for your in-laws or wife's relatives every time when they visit to you. For 24 hours, that driver and vehicle should be with them. So you are loved by your wife. You have to show sympathy for poor relatives also. Otherwise, it increases the stress in the family. Second is post-death visits is a must. Find out some time and go for that. Otherwise, it increases again the stress. You also feel bad that you are not gone. So please don't do that. Kids are the stress relievers. Sir, next slide, please. Kids are the stress relievers. Love them. Attend school functions of the kids. Please do not neglect that. Every kid's father or mother or parents, they go to that. You also go to that. Leave one call and go to that. Your kids feel better. Go to the parent meet in the school. Sir, please place for the pictures. So this is how you have to deal with the kids. Your parents are your boosters. Your parent had come to your school. You have to also go to your kids' school. So every time you have to go like that. Resuscitation. Do not opt for baby resuscitation unless emergency. When you are doing a cesarean section, ask the obstetrician to call a pediatrician, because if you go for the resuscitation of the baby, you are neglecting the patient. And if something happens to the patient, then you know what happens to you. There is a stress, a lot of stress. So please do not call pediatrician for that. Never keep any complicated case the first in the list. So next slide, please. Do one or two small cases. Press once for the picture, sir. Do one or two small cases so you have work satisfaction. You earn money also for that day. And more time can be given a moribund patient. The picture which you are seeing of a boy 17 years old, if I do this case first in the list, then my whole day is fired. So I did it in the afternoon, and then we finished it somewhere at 6 o'clock in the evening. But if at all by bad luck of yours and the patient pops off, then your day is finished. So please do such type of cases in the afternoons when you have sufficient time. So next slide, please. Try to keep some minor case in between two major cases for relaxation, your own relaxation, so that you can go and have coffee, or you can go and have some chunk, you eat something, have some energy, and come back nicely for the next major case. That relieves your stress. Otherwise, what happens? If you do so many cases in line without having anything in your tummy, you are bound to get the infection. The next slide, please. Never ask any person to fill up syringes with drugs for you. I have not done that practice at all. Once I did it and I had a lot of problems. Mistakes and error can happen there and there only. Check all drugs yourself and fill the syringes yourself only. Next slide, sir. Suction is the life of the anesthesiologist. If something happens, then this prevents the death of the person from aspiration. You can train your driver in repairing the suction. Repairing of the suction is easier unless the motor goes off. Otherwise, it is easier to repair. Your driver should be trained in checking the suction, and not only that the motor is on, it should suck also. So he has to check the actual working of it also, so that whenever it is required, you can use it. If there is no current, then this is the life-saving part, that is the foot suction. And you should have adequate size catheters in the nursing homes, because when I went at one cleft leak, some 6 months baby, there was an adult catheter of big size which would not have gone into the anus of the baby also, and thus the stress starts there and there only. So please check the things earlier. Always keep drug stock with you, because sometimes some of the drug which you want may not be with the nursing home, or they might have finished their stock, they have not brought it. Decide the drug which you are using for a particular case before going for that particular case. Do not change it in time, because you are given a thought over it and then you are doing it. Next slide, sir, please. Check the stock availability in the nursing home of the gases, of the soda lime, ventilator, whether it is working or not, monitor or pulse ox, or keep everything with you. I used to have my portable boils machine in my car. I did the practice with that for 20 years. And I used to have everything in that. But that time, the boils machines were not there in the nursing home, so I did it. But every time you had to check it before starting the case. So next slide, please. Now I am making you aware of some of these non-technical things which are not helping you in the anesthesia practice, but they will help you in reducing the stress. How? Next slide, sir. Payments. Say boldly what are your charges, because most of the times we lag there and there only. Most of the times what is the answer given is pay whatever you are paying to my colleagues. No, not that. You say, I want 1,000 rupees, I want 5,000 rupees. He may not call you, but say it boldly. Be clear on the payments. Be very clear on the payments. Give receipt to every patient. I have given receipt to every patient, whatever payment I have received for last 30 years. And I have got a record of that. Tell surgeon what are the benefits of direct collection from the patient, so that that money does not go to surgeon's account and then he pays to us. So unnecessarily there are 3 entries. So it is easier that let the patient pay me directly, whatever money it is there. So next slide, please. Be friendly with the surgeon and the staff. Give some party to the surgeon. At least in 6 months, give one party to the surgeon, so you are more friendly with your surgeon. Do not scold the staff of the surgeon. Do not scold the staff in your OT, even if you are working in the medical college, because they are not your servants. They are the servants of the medical college. They will not listen to you, and they will try to avoid you whenever you come in front of them. Give treat to your staff wherever you are. Either you are doing private practice or in the service. Give treat to your staff. It hardly makes any difference to you if you give a treat. So next slide. There might be some alternative source of income to you also to reduce the stress. If your practice reduces drastically, or if you get some problem, then there should be some alternative source of income also. So you start GP in the evening. You can do it very easily, general practice in the evening, because you know how to treat the respiratory cases, cardiac cases, and other GI tract easier, very easy. No problem. Most of the common conditions you can treat very easily. You can have a GP, you can have a contact with the patients. You can refer your patients to your own surgeons. So your surgeon will respect you more. They will respect you more. Otherwise, they will look at you with different attitude. Go for the second business, which is not person specific. Sir, please press for the picture. This is my second business. I have got honeybees, and I have got 6,000 boxes of honeybees in Punjab, along with one of my brother. And we are collecting honey from that, and we sell the honey also. He does most of the things. I am a sleeping partner, but still I have got a source of income, other source of income from this. So please go for the second business and the second source of income, which is not person related. Our practice or our medical college practice is person related. It should not be like that. So next slide, please. Be social. Be social. Go to the functions of the IMA, ISA, Friends Club, or any other non-medical friends, drama, movie, whatever it is. That will reduce your stress and you are fresh next morning for doing the cases. These are the stress relievers. You meet so many people, you talk with them something other than the medicine, something other than anesthesia. So next slide, please. Insurance. Nowadays, it is very important. Indemnity of about 5 CR is minimum nowadays. But you have to do other things also. Be friendly with some of the lawyers. Be friendly with the police. Have some friends in the police also. Be friendly with some politicians as ward members, MLA, MP. They will solve your most of the problems. And do not go for the undue risk. Do not say that I can do anything on this earth. No, not at all. They have got limitations, and you should understand your limitations. Please do not go for undue risk. The next slide, please. marriages of your son or daughter is the most stressful part in your life. And if your son or daughter decides their own life partner, please don't say no to them immediately. Go for whatever it is there, ask them, talk with them very nicely with love, inquire about their friends, and then take any decision. Please do not hurt your son or daughter. It will hurt the whole of the family and it will increase your stress. And if something is done by your son or daughter, then you have for that stress, lifetime stress. So please think 100 times before doing anything. So next slide, please. You have to have a good retired life also. Try for good retired life. Accumulate FD worth rupees 2 crore apart from your property. Because when you practice for 30-35 years, you own some property also, which costs some crores of rupees. But still you should have a cash things in the banks, FD, worth 2 crores, so that on their interest, you can lead your rest of the life after 65 years. So you're not dependent on anybody. And nowadays, we all know that the sons or the daughters, they don't remain in India. My son is in USA and daughter is in UK. So we two are here only. So we have to look after ourselves. So it is better that you should have your own income for your own livelihood after 65 years. Try to finish your responsibilities by 62 or 64, so that after that, you don't have any liabilities and you can lead a stress-free life. If your liabilities go up to 70 years, then it is real stress for you. Sir, next slide. Stress is a part of everyday life and stress is necessary. Without stress, you are lazy. When you say that I have to go tomorrow morning at 7 o'clock for the case, you get up early, you get ready. That's a little stress, but it is always there, it is necessary. Ensure that the stress is always with us. Otherwise, you become lazy. If there is no case, you will get up at 8 o'clock. You will do everything slowly. Please don't do like that. Now, these are the three wheels which are related with the stress: time, money, and relationship. Relationship with the family, relationship with the surgeons, obstetricians with the staff, time when you want to go for the calls in time, and the money which you get out of that. These are three interrelated things. Next slide, please. Sir, this slide is from Dr. Meenakshi Sundaram. Please excuse me that. Stress in LSAS. What is the stress in LSAS? See, before doing the LSAS, the obstetrician looks like this. Very good. She is going to deliver a baby after the cesarean section. But if something happens like this becomes the face of the obstetricians if there is a PPH. So please be ready for facing anything in the LSAS at any time. Next slide, please, sir. When you go for the shopping with the wife, in between the two cases, be sure about the time, because I'll show you one picture. So please place one for the first picture. How a man shops and what is his pattern of shopping, that I have shown it. You enter into the mall, you purchase whatever has been told by wife and you come out. But whenever you go with your wife for the mall for purchasing something, sir, please place again to show the second part. You have to sit on one chair in the mall and your wife will go on roaming in the mall like that. And she will finish after half an hour or 1 hour. By that time, your stress goes on increasing and you will lose the time for starting the next case. So be aware of this thing. Shopping with the wife after finishing the list, not in between the list at all. You have to reduce the stress for the next thing. So next slide. These are the everyday pressures, financial pressures, some EMI, some loan return, whatnot, everything, deadlines for certain bills, some arguments with somebody, some family concerns. You have to go to the school of your kids, you have to go to the college, you have to attend some meeting. You get lack of sleep sometimes due to so many cases in the night. So these are the everyday pressures in everybody's life. Even in the medical colleges also you get this thing. You got arguments with your HOD, you got arguments with your staff. Your juniors also do arguments with you. They don't cooperate with you. Whatever it is, these things happen in everybody's life. Forget when you are doing practice or you are in the medical college. So next slide. What is the effect of all this? You reduce the productivity. You go for social withdrawal. You don't want to go anywhere then. And you become defensive. No, this is a difficult case. I will not do it. So these are the effects of this. Sometimes, sir, next slide, please. Sometimes in your life, you get traumatic events also. Sometimes you met with an accident. Your son, daughter, your father, mother, somebody met with an accident. Sometimes you get floods. In our city, we get floods every alternate year. And there is a water in our city for 7 days or 8 days, 10 feet of water. So that's a trauma to everybody. House collapse. Sometimes there is a house collapse. Sometimes there are thefts. Sometimes there is a loss of life. You lose somebody's life in your family, which is important. Younger ones, older ones. Court matters. I am facing a court matter for last 25 years. So those are the things which will cause you traumatic part. So you have to come out of that. You have to keep your mind cool. And hospital deaths. If you have got a hospital and there is a death in your hospital, those are the traumatic events. So you have to come out of that. You have to behave very coolly for that. All these stressors lead to what? The next slide. Again, next slide, please. You take the help of this thing, which you should never take the help of this thing. Please don't go for this, which is not good. So next slide, please. You get a rotating leg syndrome. You don't get the sleep in the night. You go on crushing your feet one over the other, and you don't sleep nicely. So next slide, please. You get addicted to something. Because your income has reduced, you will break the cigarette into two parts and you will enjoy the two parts at two different times. So you get addicted to that particular part. Sir, next slide, please. You get insomnia. You get up in the night at 2 o'clock, at 3 o'clock, something like this, and you don't get the sleep. So these things, they happen with the stress. Sir, next slide, please. Anxiety. You have got tremendous anxiety whenever you are talking with anybody if you are under stress. This is a small thing. Somebody rings for you for a small thing, but you talk with them loudly. You talk with them with stress. Sir, next slide, please. There is a depression sometimes if you lose your father untimely, if you lose your son, if you lose your daughter. Your son leaves your house, your daughter leaves your house and gets married without informing you. You are under depression. So these are the stress parts. This leads to something else. The next slide, please. Sometimes in the families there are divorces and remarriages. There is a fight between husband and wife every day, and the kids, they sit like that and they go on listening all these things. So there is a stress in the family continuously, and then you cannot practice nicely. Sir, next slide, please. You get a eating disorders. You don't eat it. You try to keep them in a straight line without putting into your stomach. You try to put that. You try to adjust that. So this is a eating disorder. Next slide, please, sir. Suicide prevention. Sometimes you think of doing a suicide. Sometimes your friends also go for this. But you have to visit your friends and prevent them from doing this. Because something or other stress is always there in everybody's life. But suicide is not the answer for that. Facing it boldly, talking with your friends, finding out the solution is the answer to it. The next slide, please. Grief and loss. We have lost a cardiologist at his age of 39. He started his practice at 32. We have lost him at 39. His son was 5 years old. Youngest son was 5 years old. And their father and mother were 72 and 68 at that time. What they must have thought at that particular time. The only positive thing in that family was my friend's wife is pathologist and she was working in the medical college. That's the only thing. These things can happen in your family. So be aware of all these things. Learning disabilities. Your son is not very intelligent. Don't try to force them the things that you must become a doctor, you must become an engineer. No, not at all. Just the things, what he can do it nicely. Ask them to do those things only. Otherwise, you are under stress continuously in your life. Sir, next slide, please. Teenaging. Your young daughters or your young son they are definitely more headache than anybody else. They want anything at any time, and you have to give them like that. Otherwise, they are very badly, they will behave very badly. So teenaging, you have to handle it very nicely. Very softly, you have to handle it. Sir, next slide, please. So for all these things, you have got certain coping skills for stress management. Those are, what are they? Deep breathing, sir, press for the picture. Deep breathing. Go for exercise. Go for relaxation. Nice relaxation, go for exercise. That will reduce your stress. Sir, next slide, please. Get yourself organized. Use the calendar. This date I have to do this. This date I have to do this. I have to pay my EMI at this date. So if you get organized yourself, your stress is reduced. Do the list of the things which you want to do. Very easy. Keep a positive. Next slide, please. Keep a positive approach. Keep a positive approach. Think for anything. You get a good ideas. You try those ideas. You do it. You may not succeed it. You do it again. You do it again. It is like that. Go for healthy eating. Sir, next slide, please. Go for healthy eating. You may eat with your friends. It not be every time with your wife. So weight loss. Go for the weight loss. Reduce calories intake. Weight will automatically reduce. Exercise will go. Sir, next slide. Exercise will reduce your loss. Good habits, no sugars at all. Sir, next slide, please. Diet and weight loss. Do not eat burgers every day. It will not reduce your weight at all. Sometimes it is okay. Sir, next slide, please. Be aware of sugar belly. Fat around the abdomen is an indication of your diabetes is hidden from you. So make sure that your vital organs are not bited by the diabetes, heart, kidney, brain, and liver. Reduce calorie intake. Avoid sugar, rice, ice cream, so that you keep yourself fit. Sir, next slide, please. See the parrots. See the parrots. How much they eat. Who tells them? Who teaches them to diet? Have you any time seen a 50 kg parrot? No, not at all. Their weight is somewhere about that, 4 kg, 5 kg, maybe lesser than that. But they diet themselves. Why? When the animals can do it, why we can't do it? We should also do it and reduce the stress of getting something else in your life. So next slide. What is the best diet? One which will reduce calories intake. Sir, place for photographs. Healthy for your heart. That diet you should take. Sir, press once again. One which suits and you will stick to that. And fruits and vegetables. Sir, press for the photographs. These are the things once I have prepared them. Then I started all these things and I prepare it sometimes every now and then. But this is the best diet for you. Please do not go for the other diet which doesn't suit to you. Everybody is eating, so you start eating. Please do not do that. Next slide, please, sir. Healthy relationship with the wife. What a healthy relationship. You are seeing it in the picture. See, if it happens in your family, I will go in between the calls and get shot myself from my wife and have a stress relieving every time. Sir, next slide, please. You should have a good sleep. Good sleep is essential for energy, health, productivity, emotional balance. And most of the people don't get it nearly nicely or nearly enough. So please go for a good sleep. Sleep earlier in the night. Do not go up to 1 a.m. or 2 a.m. Sleep at 10:30, 11 o'clock. Sir, next slide, please. There should be no insomnia. And you should try to sleep it earlier. You should have a good food in the night and sleep. Do not go for the mobile in the night for a long time. Next slide, please. So snoring, if your partner is snoring, you cannot sleep. So please treat for that particular part. Sir, next slide, please. Work and career. So if everything is good, sir, please press for the photograph. There are three photographs in it. See, if you are satisfied with everything, there is no stress. You go for the work early in the morning. You do the painting of the back nicely. You put the needle. You get what a clear and exact CSF you are getting. No streak of blood even. You must be very satisfied with it and inject the drug and it acts nicely. So that is the work and the career if your mind is set. So next slide, please. Grandparents in your house and the parents in your house. Give love to them. That reduces your stress. Do not neglect them at all. If they are asking you to do something, please do for them that particular thing. Otherwise, it keeps in your mind for continuously and you are remembering it every now and then. So please do that. Next slide, please, sir. Gardening. Gardening relieves your stress. This is the gardening I do on the terrace of my hospital building. And I spend most of the times there, some 2-3 hours in a day, sometime in the morning, sometime in the afternoon. And it relieves the stress and it gives you pleasure also. So do gardening and trip for pleasure. This is Maldives. I'm always afraid. I went once and I decided I will not go there. If you go to the Maldives restaurants, you will find that there is water everywhere. There's the airstrip. There is a water. If you get a water on the airstrip next day morning, what you will do? So I never turned back to Maldives. I went once only. But you go for a good pleasure trip. Walking is the best exercise which will reduce your stress. Family trip. That's my wife and my daughter-in-law and myself. We went for the family trip every now and then we go. Once in a year we go to my son, and now I have to go to my daughter also, who is in the UK from last September. So we will have to do 2 visits every year. That we will do it so that we will reduce our stress. So make a family trip every now and then so that it is easier. Parenting. See, who doesn't like to have a kid? And everybody loves kids. So parenting is very good. You relieve your stress with the parenting. You spend most of the time with your kids. You enjoy it. But the parenting should not be this tune, sir. Please praise the photograph for that. It should not be this tune. 1, 2, 3, 4, 5, 6, 7 kids. Difficult to manage. So parenting should be limited, and you will enjoy and you will relieve your stress. Sir, next slide, please. Yoga. Yoga, if you are doing a yoga, it is really very good. And it is really wonderful to do the yoga. It will reduce your stress. It definitely reduces your stress. It keeps you fit also. So these are the stress relieving factors which you should do. Now, caregiving to your grandparents is a stress relieving factor. If you talk with them nicely, they are happy, they talk nicely with you. That is a stress relieving thing. Very nicely stress relieving thing. Your wife also should talk to your grandparents, and they will reduce the stress. So next slide, please. You should know your limits. What are your limitations in your city? Be realistic. Don't try to do any heroic thing, because you will land in trouble. Next slide, please, sir. So you have to change the attitude. See the serpent there, and there are so many persons who are there by the side. They are ready to tuck him over there. So you have to learn from them. Now you have to learn and see the stressful situations as challenges. You have to take a challenge for that, and you have to solve that stressful situation slowly, not in a day, so that you will relieve your stress slowly. Think 100 times before relieving. The next slide, please. Realize that most stress comes from within and not from without. You are responsible for producing stress in yourself. So you have to only relieve your stress. Sir, next slide, please. It takes time to smell the flowers and taste the strawberries. It is but natural. You put a plant and you don't get flowers next time. You put a plant of a strawberry and you don't get the strawberry next time. It takes time. Everything has to be given time. So please press for the picture. That's a picture which you are seeing. Somebody is trying to go for the hall which is there, Golden Hall. And he just reaches there. You never know how close you are with that, how close you are with your goal. So you never give up your dreams. So it takes time to smell the flowers and taste the strawberries. So these are the things which happen in the life. Sometimes
Sir,
you
Desh,
believe that, and golden opportunities they go back.
one minute,
Yes, sir.
Deshpande sir, again it got stuck. That slide
Sir, it
show.
is finishing now. It is almost last slide, sir.
Yeah.
Keep it in
But it's
mind.
not.
I am talking, sir.
Yes,
No pictures.
it has
Keep
moved.
it in mind, when we started our family life, we were only two, yourself and your wife. Now, at the end of my 68 years of my life and 62 years of my wife's life, we are only two. Life is all about how you see the things. And for everything, your plan B should be ready. Thank you very much for listening. Thank you, Meenakshi sir, for helping me. And I'm sorry I could not do it from my side. Thank you very much. Thanks a lot, sir.
Sir, thank you, sir. Thank you, sir. Actually, we should thank Ashok sir. Despite being ill, he has given a very good practical knowledge on how to handle the stress. And number two, we had a practical demonstration today on a stressful situation. We are unable to project the PowerPoint, but we coolly handled it by school nature, and as well as with the plan B by our beloved Meenakshi sir. We are able to continue with the program, smooth, seamless, and it was very nice. I want to know whether this stressful situation was a planned one or unplanned one, sir. very nicely handled. Very nicely, and we gave a practical demonstration to all the people who today attended the meeting. We should always be ready with a plan B, plan C, plan D, whatever, and we should very coolly handle it. It's very nice topic, sir. Very nice. Many things which you told, most of the things I came through my practice, sir. So it is a very nice. Young generation should definitely take advice from the seniors regarding how to handle the stress. And thank you, sir. Thank you very much, sir. With this, we are coming to the end of our session. I now calling upon the academic chairman, sir, Dr. Elam, sir, to take over this session, sir.
No, if Dr. Chairperson, sir, if there are no questions in the chat box or anyone wants to interact, we can hand over the session to the Pudukkottai ISA President. Because it is a wonderful lecture. It is a wonderful lecture. Now I want to say only one thing. Even though life is full of stress, and even the stress-free anesthesia was also put under tremendous stress. As an anesthesiologist, we know how to tackle that. Because we have tackled the situation, only anesthesiologists could do that. In the scout, the motto is always be prepared. But as Sar has said, in a difficult case, we have to have two anesthesiologists. I like to one statement. In a VIP, two anesthesiologists, and in difficult cases, sometimes a physician. So anesthesiologist scores over everything. Now two anesthesiologists, Sir and myself, I moved the slide and he delivered the lecture. So we have proved that anesthesiologist can tackle any situation because the situation could be easily managed. However difficult a case may be, or a webinar may be, we are here to do that. Because the moment he transferred the slides to my mail, again I downloaded, I could keep up with the pace with him. So we were very happy. Really, it is a stress-free anesthesia, and anesthesiologist is responsible for this. If there are no questions, I think we can hand over the session to our President, Dr. Suresh Kumar.
Sir, Meenakshi, sir.
Any questions, sir? If there are no
Meenakshi,
questions,
sir.
then we can answer.
May I talk?
Yes, sir.
Anybody
Yes, sir.
want to
Thankful to
interact?
Meenakshi for I am thankful to Meenakshi for doing the PowerPoint presentation for me. Thank you very much. Thanks a lot. Plan B was successful.
Sir, I am very happy. Without any this thing, you have handed over the whole presentation to me. Any rights,
Sir, nothing is there,
copyright.
no secret in that, sir. No secret at all.
But
Even if you want to present it anywhere, you are allowed to present it, sir. No problem. No problem.
sir, you have given up to till our death, you have given the way how to live stress free. Even up to the grandchildren, you have given the way. So this is totally a different way of managing. It is good. So we know stress.
But our plan B worked out very nicely. Plan B worked
Yeah.
out very nicely. Thank you, Chairman, sir. Thank you.
Yes,
Thank you,
sir.
Pudukkottai, all office bearers. Thank you.
Yes.
Thanks,
Yes,
sir. Back to Dr. Suresh Kumar, President. Sir, Dr. Suresh, sir. Okay, now I request Dr. David to propose vote of thanks.
Yes, sir. Good evening to all. On behalf of ISA Pudukkottai, first I'd like to thank our academic chairman, Dr. A.L.M. sir, for successfully conducting the 47th webinar. Thank you, sir. And special thanks to today's chairperson, Dr. Bhaskar, sir, for nicely connecting the session. Thank you, sir. I'd like to thank today's speakers, Dr. Ashok Deshpande, sir, and Dr. Balasubramanian, sir, and Dr. Vigneswaran for making wonderful session. Thank you, sir. And also thank other faculties and postgraduate, like Ikirola and Avologic for technical support. Thank you all.
Thank you. Sir,
Thanks,
we
sir.
will leave
Thanks
the
a lot,
meeting.
sir.
Thank you then.
We'll leave it, sir. Thank
Thank
you,
you,
sir.
sir.
Thank you.
Thank you.
Thank you.
Thanks all. Thanks all. Bhaskar, sir, namaste.
Sir, namaste, sir. Thank you, sir. Take care of your health, sir.
Balasubramanian, sir, namaste.
Thank you, sir.
Thank you, sir. Thank you for giving me the cooperation. Thank you very much.
Thanks, sir.
Even logistics can end the show.